We didn't see patients by appointment in those days. I don't think anybody and any of the other doctors in town were seeing patients by appointment. A patient would walk into the clinic, register, say who they would like to see, and then sit down and wait. In those days, it was a requirement that if you were doing major surgery, like abdominal surgery, something like that, any major surgery, you had to have a second physician scrubbed in with you. So that was a slot that I had to fill at that point. We left Dr. Kilgard and Dr. Clark handling the clinic, and at least half of most days I was tied up being an assistant to the surgeon in surgery. In those early days, we didn't have any plastics like they have today. All the syringes we used were glass syringes. They had to be cleaned and re-sterilized and used over and over again. The same was true of the needles that went with these syringes. They had to be cleaned, re-sharpened, and re-sterilized and used over. All of the surgical gowns, masks, all of that stuff were all cloth. They had to be washed and re-sterilized. So that in itself was a big job to keep all that going. You reused rubber gloves. So you had to check them. If they didn't have a leak in them, you cleaned them up and re-sterilized them and used them again. There were some students that I mentored over the years that I didn't really get that much out of, But Rick was an exception, and I had the impression when I had him that he was a young man that was going to do well in his profession, and I think that's been brought out in subsequent history.